Trained on mental health treatment and management. This is the call at the World Mental Health Day commemorations at the Mathare Hospital right here in Nairobi County, with stakeholders in the mental health space calling on the government to increase financing in the sector. The event is currently ongoing. Let's listen in.
They are able to volunteer. What they need is support. Are we able to provide that support? And do we have the structures to support that? As a nation, do we have structures to support such people? So it is really important that we examine ourselves again as a nation and put this challenge, this mental disease, in the forefront. When there was an outbreak of AIDS, for example, it was declared as a national pandemic. And we fought AIDS. There are survivors of AIDS who are still playing a key role in our economy. They are leaders in their different capacities because there were structures that came in to support. When we had COVID-19 pandemic, similar thing was done and we defeated COVID. Now that we are facing this challenge of mental health, we need to build proper structures within the government to support all our youth because that is our nation. The youth is the nation that we call Kenya. If we destroy them, if we allow this mental disease to destroy our youth, then we will not have a future of our country. It's high time that we now bring the youth to the fold so that we're able to understand. And I want to challenge the youth. Whenever you have a problem, and we've said here that move closer, let the public be your supporters. Anybody who is next to you be your support. Those who, the group that was taking us through, very informative, that problem shared is half solved. These things are happening within our communities. And I'm very happy to inform you, and you saw, and on the 20th, His Excellency, the President, is going to launch the 100,000 community health promoters across the country. These community health promoters are now well-equipped, well-trained with health information. And I want to say it's not just going to be about malaria. It's not just going to be about HIV. It's not going to just be about hypertension. It's not just going to be diabetes. Yes, we have given them the right kits to diagnose hypertension, for example, which we know the challenges we are facing through in that. We've given them the kits to diagnose people with the diabetes because that requires a gadget to examine. But we have also equipped them. We have equipped them with the knowledge to address mental challenges within the community, within the households itself. Because as they visit the households, they will be able to ask the wellness of that family. Wellness means everything else. If you woke up well,